All right, I'm gonna show you guys how to do a wet to dry dressing change. That is a sterile skill. For this person, we do have a little wound here. I'm gonna be doing it on a table. You have to pick the best location on how you're gonna be with your patient. So I've got a lot of different supplies because you may not know exactly what is being used under, in all your dressing changes. So I just went ahead, grabbed all kinds of good stuff. Don't forget though, whatever you take into the patient's room, you cannot remove. So don't bring in a lot of excess supplies. First thing I'm gonna do is you always wanna make sure your table is nice and clear. I've got a couple various things. This is a gauze bandage roll. We don't need this for this patient, but if you needed to say wrap around a foot to secure the dressing, that could be beneficial. I do have what's called an ABD pad, or this is a combine pad. It's called a lot of different things. It's like a thick pad that will go over the top. I've got a fluff sponge. That's what we're gonna use to pack the wound and cover it up. And non-woven gauze sponge, same concept. Got some sterile gloves, and I got a towel drape because I'm gonna put all my sterile stuff there. Also have sodium chloride for irrigation or whatever the doctor puts in or the wound nurse puts in that you're gonna use for your patient. For this patient in particular, this is what we're gonna say was prescribed. All right, so first thing I wanna do is open up my sterile field. And if you guys watch these videos, you'll know that there is a sterile field video that you can use and follow, but I want to follow my little 1-inch margin all the way around, and then you reach in to a corner and lift it straight up. Go ahead and toss this. Remember, I've got my 1-inch margin. Well, okay. There we go. Some things are a little hard to find. I'm gonna drape this over my table. Normally I would go this way, but just for demonstration purposes. Now I gotta drop my supplies. You always wanna drop at least 6 inches above. Inches above. And 6 inches above. You may have seen my gloves kind of touch the side of this. It was not within the 1-inch margin, or it was not inside that, past that 1-inch margin, so it's still okay to use this sterile field. If it had gone past that 1 inch, I would just have to start back over with my sterile field. I also have, this is going to be a sterile cup inside, so just make sure you don't touch anything on the inside. You always put your hand over the label of any medication or anything you're going to use. And we're going to pour. Pour however much you think you're going to need. And now we're gonna go ahead and say we've cleansed the wound, however they want us to cleanse it, so whatever kind of product they want. We're gonna use some sterile gloves. While I'm doing that, I'm gonna go ahead and actually move our wound a little bit closer to me. Remember, you don't want to cross over your sterile field. Make sure you follow that sterile field checklist or video that you guys have already seen. As I start getting my hands in there, I want to get that thumb out so I don't accidentally touch it. Actually, see, look, you guys can see it didn't go on exactly right, but sterile can touch sterile, so I can correct myself. Okay, now everything's in here and I can move things around. So I've got my ABD. I've got this, that'll go on next. And this is the part that's actually going to be what we insert for the wet to dry dressing. So in doing this, remember this is sterile, our water is sterile. I'm gonna come off to the side. I'm going to dip this in that water. I'm not gonna do it now just because I don't want wetness on our actual mannequin skin. So I would get it nice and wet, but then wring it back out. Okay, then you need to bring it around here because I don't want to cross over anything wet with my sterile. So if you have a wound like this, I can see it pretty well. I don't have to like get deep in. If it's in, you may need to use like one of the sterile cotton balls. So for this, I would slowly start to insert this into the patient's skin. Now, since their skin is a little more pliable than mannequin skin, I'm gonna just kind of hold it here. We're going to drop that, and we're gonna get the fluff gauze. I want to make sure to cover the entire bit with fluff gauze. And then you take that ABD. I like to have the ABD with the blue side up because then I can monitor it and watch it a little bit better. And then when you tape, make sure you know what your policy is for taping. You never want to tape completely around the limb. And what do I mean by that? I'm going to show you on my hand. If you're doing a dressing, you don't want to tape the whole way around and touch tape to tape because that can actually occlude some of the person's circulation. So usually we do what's called a window frame tape, which my tape is nice and torn. There it is. Okay. So for a window frame tape, you will, I'm going to show you guys how to do it on this table. Of course, don't do it on the table, you do it on your mannequin. You'll tape across this way, then this way, that still allows for some expansion of the skin. So for this mannequin, we are going to get our tape loosened again. I'm going to tape. I'm actually going to end up taping around him, but normally this would be on his limb or leg or wherever the wound is. Flip it around. Again, this would be wherever the wound is. This would go over the skin like that. For this, wrap around there. You can kind of look that way, approximately the right length, and I would connect that to the person's skin. And then the last piece, so this completes our picture frame. So this would connect to the client's skin. And now the client skin has room to move, and also you can monitor the dressing for any drainage. If you do note drainage on the dressing, make sure you mark it with some kind of a marker that stays with that patient, so you can monitor the drainage and then change it if it becomes soiled or if the doctor has it ordered to be changed for a certain frequency.